Hello, everyone. I'm Dr. Robert Kersner, Chair and Harvey Blank Professor of the Dr. Phillip Frost Department of Dermatology and Cutaneous Surgery at the University of Miami Miller School of Medicine. And I'm thrilled to welcome you to our 2023 open house to have you learn more about our department so that we can find a great fit for you for your upcoming dermatology match. This is the medical campus at the University of Miami. In your foreground is the original hospital for Miami-Dade County, and in the background is the current hospital for Miami-Dade County, Jackson Memorial Hospital. Our medical center is one of the largest in the country, if not the largest. Where that arrow is pointing is that picture I previously showed you with the old county hospital in the center. But this full circle is the current medical campus of the University of Miami. At the very top of your screen is the Atlantic Ocean, then Miami Beach, Biscayne Bay, downtown Miami. And the medical center is at the crossroads of I-95 and 836, two major freeways that serve the medical center. We think that the clinical training is the best you can possibly get for dermatology in the United States. And we believe this because we have the best patients. We have a great faculty who provide spectacular mentorship. You have the opportunity to contribute to dermatology through scholarship and research. We have a great tradition of dermatology in Miami and a spectacular network of alumni and faculty members throughout the United States and the world. And we have a great and fun city that is which is Miami. All of that contributes to the best possible training you can get. Now, our legacy, or what we're very proud of at the University of Miami, is really could be simplified into three major areas. The first is leadership. When you come to the University of Miami, our goal is to have you become not just a great dermatologist, but become impactful beyond just the walls of your clinic. And there are a lot of ways to become great leaders. We certainly have had an impact on academic medicine, and over 25 of our former residents and faculty members have gone on to chair departments of dermatology throughout the U.S., including 6 that were founded by University of Miami people. We've had people who have been leadership positions at the National Cancer Institute, the dermatology branch, and the National Institutes of Health, including the directorship of the National Institutes of Arthritis, Musculoskeletal, and Skin. We've had AAD presidents. We've had journal editors. In fact, the first editor, the founding editor of the Blue Journal, Journal American Academy of Dermatology, was a Miami person. The second area that we're very proud of is innovation and discovery. Many of the first, both in biology and science and therapy, came from Miami, but also the first of ideas have come from the University of Miami. We're the first department that has added cutaneous surgery to our name, recognize the importance of surgery to our specialty. We were the first department to have a full-time Mohs unit and the first to have a full-time dermatopathologist, among other examples of firsts. So our leadership, as I outlined here, is former heads of NIAMS and chiefs of the dermatology brands. But it doesn't just stop in academic medicine. We've had experts, both in academia and practice, in all areas of dermatology, psoriasis, dermatopathology, skin surgery, cosmetics. We've had people from Miami going on to become billionaires and influencers. And of course, leadership in many of them, if not all of the major dermatology organizations. Currently, a former Miami graduate is president of the American Academy. Currently, the current vice president of the American Academy of Dermatology is a former Miami graduate. And currently, the assistant secretary treasurer of the American Academy of Dermatology is a Miami graduate. So our impact is beyond just the walls of our clinics. And we expect and hope that you will have the same impact after you're done with your clinical training at University of Miami. Now, as you probably are aware that dermatology is not ranked by US News and World Report, but by reputation, we are ranked very high or considered very high. This is a recent Google search of top dermatology programs in the world, and at least this one search thought that University of Miami was number 5. But whatever search is, whether we're number 5, number 1, or number 10, we're well respected, both locally, nationally, and internationally as a premier dermatology program. We're about 67 years old. We celebrated our 60th anniversary a few years ago in 2016. We're very proud of our accomplishments. I am the 4th chairman of the department. We've had 3 others. The first and founding chairman was Harvey Blank, who was a giant in dermatology. He did many, many things, which I'm not going to go into great detail, but this is a list of some of the things he accomplished in creating, for example, creating the first oral antifungal ever used, and many of the other firsts I mentioned previously. Bill Eaglestein is the 2nd chair of our department. He trained at the University of Miami, went on to become chair of dermatology at the University of Pittsburgh, and then returned to Miami, where he served as chair for 17 years. One of the godfathers of wound healing. He developed the first porcine model of wound healing for the lab, but also was a great champion of occlusive dressings and moist wound healing. And if you go to most pharmacies in the United States today and look at the shelves, many of those, if not all of those products that you can buy at some point in time were studied at the University of Miami. Larry Schachner, a renowned pediatric dermatologist who remains on our voluntary faculty, retired from full-time academia a couple of years ago, led the department for 10 years and had many firsts, including our first biologics clinic, where patients with psoriasis who are on biologics could get access to those in our county clinic setting. During my tenure, we've had a tremendous amount of growth in our department. We've more than doubled the size of our faculty, both our clinical and research faculty. And our faculty really represents the city of Miami, where over 60% of our faculty are internationally born. So we believe we take the best and brightest from other places, bring them to Miami, and as a trainee, you'll have access to some of the greatest minds in dermatology, clinical care, and in science. Currently, we have 39 full-time research, full-time faculty, 18 of which are research faculty, 15 of which solely do research in our department. We also augment our clinical faculty with staff physicians, and we have a group of about 35 clinicians who provide care for our patients in our clinics, and another 140 voluntary faculty who teach or come to our clinics and help educate our residents. We have a vibrant program. We take 23 residents, including currently 2 in our research MD PhD research program. We have the only master's program in skin biology and dermatologic science. We have an international program where physicians and dermatologists from other places come and observe. So it's really a vibrant educational community that you're going to engage with should you come and train at the University of Miami. We have a tremendous mentorship program where our goal is to nurture your personal goals. We say we have a personalized training. 80 to 90% of your training is going to be the same as every one of your co-residents, but then we individualize your training through mentorship and special electives so that you can make sure that the training you receive is special for you and helps launch your career moving forward. For those that are interested in academic medicine, we have the Dermatology Academic Training Program, which mentors residents towards a career in academia. But whether your interest is in academics, clinical practice, industry, regardless, our goal is to make you the very best you can possibly be in the setting you choose when you finally graduate. One of the things that makes our program special is our patients, and we have a great patients because we have a huge catchment area. We're the only academic dermatology program in southern Florida. Our closest academic other training program is in Florida, 5 hours away, in Tampa and Gainesville. But we believe we're the major dermatology program between Caracas and Atlanta. So we have a catchment area that's the Southeast United States, Florida, the Caribbean, Central, and South America. Our large catchment area gives us access to many patients with very interesting diseases, including tropical diseases. Being in South Florida, patients often are exposed to the sun, so we have a lot of skin cancer and surgery and photodermatoses. Because we're the only academic center, we have tertiary and quaternary care, but we're also in a city where we have inner city diseases, neglected diseases, infectious diseases, and we see a diversity of skin colors. We treat young patients, but also old patients. And we also have an active inpatient service where we actually admit patients to ourselves in the hospital. So we're the primary provider of care for those patients with dermatologic diseases, in addition to a robust consultative service at both our university and clinical and county hospital settings. Now, you should know that we want you to contribute to dermatology and have access and learn about all aspects of dermatology. So while you're here, you will be required to participate in research. During your first year, we mentor you so that you can make an educated decision about what you would like to participate, with team you'd like to join, whether it's clinical, basic, translational, epidemiologic. And then over the next 2.5 years, you'll embark on a project that you'll have mentorship and supervision so that you are able to contribute to our literature in dermatology. Each year, we have an annual research day where residents will present some of their research, as well as research fellows and medical students and faculty. And it's one of the highlights of our academic year. So what we're really asking is for you to learn about our program, because we're looking for people who are the right fit. If you want to be part of a great team, if you're willing to work hard to become a great dermatologist and have lots of fun, or if you're interested in being a difference maker and making an impact beyond just the walls of your clinic, if you want to provide the highest level of cutting, innovative care, if you want to live in a vibrant, exciting, multicultural city, then Frost Dermatology is the place for you. We believe that these next 3 years of your clinical training are the most important 3 years in your career. They're so important that we're going to have and going back to in-person interviews, because we want to get to know you and we want you to get to know us. We want you to kick the tires, let you get to know our medical center, your co-residents and faculty, because these 3 years are so important. We don't want to leave it to chance and just have you have an experience via Zoom. We don't want any surprises, so that you're happy, you're excited, and you're willing to work hard to be a great dermatologist. So we will be having in-person interviews for those who are interested in our program. So it's a great pleasure to welcome you to our open house. Please learn about it, of our program, through this. Go to our website, ask questions, follow up. We look forward to hopefully seeing you at our interviews and having some of you join us as residents. Thank you very much.
Hi, my name is Dr. Brian Morrison. I'm one of the program directors down here in Miami, and I'm going to talk to you a little bit about some of our teaching sites, as well as an overview of the curriculum. So these are our main teaching sites. Let's jump right into it. So the first is Jackson Memorial Hospital. This is our primary teaching site. It's a public hospital for Miami-Dade County. We have a very diverse group of patients here, as well as many underserved people. We are responsible for an inpatient consult service, which is very interesting and robust. We see a lot of medical dermatology, and we have specialty clinics, including surgery, Hansen's disease, hair and nails, psoriasis and biologics clinic, immunobolus disorders, and pediatric dermatology. Another really important training site is the Miami VA hospital. So it's a primary referral center for South Florida, and it predominantly has a geriatric population like most VAs. So we see a lot of skin cancer, a lot of medical dermatology. It's really one of our primary training sites for surgery. We also have an inpatient consult service. Our residents occasionally rotate through a satellite clinic in Broward, which is the county just north of us. And we have two specialty clinics here, one for the use of polylactic acid for HIV lipoatrophy and another laser for pseudofolliculitis barbing. The University of Miami Hospital is the one that houses our inpatient dermatology service as well as our consult service. We have a wound care clinic here. It's our main teaching site for the faculty. Also has a very diverse patient population. And there's some satellite clinics, including the Lennar Medical Center, which is on the undergraduate campus, and some of our derm satellites in South Miami, Coral Gables, and Miami Beach, where our residents rotate. Sylvester Comprehensive Cancer Center is also part of the University of Miami, and it houses our Mohs service, as well as an inpatient onco-dermatology consult service and a specialty clinic for pigmented lesions. And then lastly is Mount Sinai Medical Center, which is more of a community hospital in Miami Beach. And our third-year residents spend time with Dr. Marty Zayak, doing a lot of surgery, Mohs, and aesthetic training, as well as seeing some medical dermatology. And they also cover the inpatient consults at this hospital. So as you may have gathered with so many training sites, we have a very large faculty. And because of that, there are a lot of areas of interest and specialty clinics. So there's quite a broad list you see here. We have acne and rosacea with Dr. Kirai, connective tissue disease with Drs. Matterall and Ellman. Cosmetics are a lot of people who do aesthetic procedures, including Drs. Hu and Mandy, Ever, Morrison, which is me, Rosen, Camacho, Hayek, Dorizis, and Hellman. We have hair with Drs. Midova and Tosti, Hansen's disease with Dr. Matterall, and this is the only one in the state, so everyone has to come down and see us in Miami. Hidradenitis with Dr. Levtov. We have, of course, the inpatient dermatology service with Drs. Kersner and Ellman. And so, again, this is a service where patients are admitted to dermatology. So we are the primary team for these patients. It's a very unique experience and one that really helps us serve our patients well. This is one of the only programs in the country that has a service like this. Itch with Dr. Josipovich, nails with Dr. Tosti and myself, patch testing with Dr. Tosti and Franca, pediatric dermatology and genoderms with Dr. Schachner, Schmidt, Anderson, and Gonzalez. We have pigmented lesions with Dr. Jaimes, psoriasis and biologics is with Dr. Romanelli. Our three Mohs surgeons are Drs. Nuri, Tang, and Rosen. Our skin of color division includes Dr. Willery Lloyd, as well as Dr. Dawes. And then we have ulcer and wound healing clinics with Dr. Kurzer and Leftov. So looking at the block schedule for our residents, so our first year residents spend a lot of time helping run the inpatient service. They also spend time rotating through Jackson, VA, and clinics and doing surgery there. They have a designated wound healing rotation and a Hansen's rotation. Our second year residents spend a little more time doing things like dermatopathology, Mohs surgery, pediatrics, post-care, and then have clinics and surgery at the VA Jackson and the University of Miami. And then our third year residents have more of a supervisor role and leadership role as Jackson chief, VA chief. They help run our inpatient consult service at Jackson. They have a cosmetic rotation. They rotate through the University of Miami clinics. They spend time at Mount Sinai, as I mentioned, with Dr. Zayak, and they have a little bit of elective time as well for their own interests and for research, quality improvement, etc. Looking at the general didactics for the week. So on Monday, we may have Kodachromes during lunch. Then Dr. Elgart gives a lunch lecture on pathology on Tuesday. Wednesday morning is our protected didactic time as a department. And so we start the morning with management conference where we see interesting cases together as a department and discuss them. This is followed by a faculty lecture for our residents and then grand rounds for the entire department. Chairman's meetings happens once every 1 to 2 months, and our residents meet with Dr. Kersner at the end of the day on Wednesday. Thursday during lunch may be a textbook lecture, and once every 2 months we have the Miami Dermatology Society, where Our residents present interesting cases to not just the faculty, but the community. And then we all go out to dinner together and usually have a great lecture from a well-known national or international speaker. It's a lot of fun. And then Friday during lunch is either a faculty lecture or a journal club. Weeknight call is evenly divided between our first and second year residents. Weekend call is covered by the first year residents on the inpatient service. Holiday call is split equally amongst the first year residents. And then of course, there's always someone for backup, whether it's the Jackson consult resident, chief residents, or any of the faculty. We're always available 24/7 for patient care. Our residents are encouraged to attend a number of regional, national, and international conferences. So all of our residents get some time to go to the AAD annually, as well as the Florida Academy of Dermatology annual meeting. We have a number of lectures by our very own faculty, even here in Miami. So we have Dermatology to the Stars with Dr. Romanelli, World Congress of Itch with Dr. Josipovich, dermoscopy training experience with Dr. Jaimes, and then Dr. Tassi has her conference in Capri, pretty spectacular. But our residents are very much engaged and attend many of these conferences. The department is very much committed to service, and there are a number of things we do both regionally and internationally. So we're engaged in street medicine here with the institution. We have a number of health fairs that we go to throughout the year. We have a fundraising SunSmart Sprint once a year. And then we have a division of global health dermatology, which I lead, that has a number of collaborations with departments and universities throughout the world that our residents have the opportunity to engage with. Residents are employees of the Public Health Trust, that's Jackson, so they can join a union if you want. You get great meal benefits, discounted parking, $2,000 for educational reimbursement, 4 weeks vacation, great insurance, medical, dental, mental health, disability and life insurance, and a pretty competitive salary at around a first-year derm resident starts at $64,000 a year. So the main takeaways are that we have a very large clinical faculty with numerous areas of expertise, superb clinical and surgical training in a setting that encourages our residents to have autonomy over time with experience. We have a diverse patient population encompassing all ages, gender identities, ethnicities, skin types, sexual orientations, religion, and our residents have the opportunity to be exposed to the practice of dermatology at a variety of institutions and clinical settings. So they're really well-rounded physicians. So thank you so much for your attention. Bye.
Welcome to the University of Miami Dermatology Residency Program, where our residents have come from all over the world to train, learn, and work together at one of the best residency programs in the country.
We are extremely fortunate to learn from experts in the field, but one of our favorite parts of the program are our co-residents.
In the day-to-day, our co-residents are more than just colleagues, they're like a tightly knit family.
Inside our department, collaboration is at the heart of our success.
When we face difficult cases, we come together to brainstorm ideas and find solutions.
It's incredible to have such a supportive team to lean on. Teamwork is the backbone of our resident-run clinics and makes all our residency so much more enjoyable.
We learn and grow together through weekly lectures, grand rounds, and case discussions.
And we celebrate each other's achievements, birthdays, and everything else in between.
We're more than just colleagues, we're friends, and we get to spend time together outside of work, enjoying one of the most beautiful cities in the world.
From Miami Spice to Art Basel, we make unforgettable memories together. We hope you get to learn a little bit about our program today, and we can't wait to meet you.
So hi, everyone. I'm Dr. Brian Morrison again, and I'm joined here by my chair, Dr. Robert Kerzner, and my fellow co-director, Dr. George Elgart. And before we get into your questions, because we're very happy to answer them, I just want to share some information with you. I'm just going to share my screen briefly. And so what I would like to share with you all are a few exciting, just hide this. Some exciting tracks that we have. So, beyond our traditional residency trainee track, which ranges from PGY 2 to 4, we have a new track called Disparities in Medicine and Community Health track. And so the purpose of this track is really to attract applicants and candidates who have a long-standing commitment to improving health disparities in dermatology, of course. And we're really looking for candidates who've really shown this commitment through prior experiences and longitudinal, service endeavors. And any resident who matches into this track, so we'll be taking one a year, their quality improvement and research efforts will be focused on this topic, and they'll have a dedicated group of mentors to really work in this area to improve the disparities of our community and the outcomes for our patients. And then, of course, we have a research track, which is not new, and we'll discuss a little bit later after we talk about our general track. So we have a whole group, so please stick around for that. We have our research faculty to talk to you about that and help answer your questions. The other thing that people, of course, want to know about are the signals. So first off, signals will be used by our department to identify candidates who are interested in our program. And you can send us either a silver or a gold signal. Either will result in holistic review of your application by our faculty. I will personally review all gold signals that are sent in, and the type of signal you send will not have any effect on our final rank process. It's not part of our calculation. And then the last thing, of course, which Dr. Kurzer mentioned already, is that this year we will be conducting our interviews in person only. We will not be able to accommodate any sort of hybrid or virtual interview. So please take that into mind. And here are some of the interview dates we have at the bottom. So our internal candidates will have their dates in November. The traditional and disparities in medicine track will be on the January 17th and 24th, and our research track will be on January 24th. So now that I've shared that with you, let's go ahead and start with some questions. So the first question I'm going to ask is one that I received beforehand and that students always ask. And I'm going to give this one to you, Dr. Kurzer. They always ask, what is it that our department is looking for when we're reviewing these applications? What is it that really makes someone stand out and want us to have them match with us in Miami?
I think the key thing that we're looking for is people who are passionate, that they demonstrate their passion for what they might have done in the past, and they'll direct that passion towards dermatology. And they've shown that passion through things they've accomplished or done during their lives. So we look for people that are doers, people that don't just say they want to accomplish something, but have shown evidence. It doesn't have to be in dermatology, because they're not in dermatology yet, but in something in their life, we would like for them to have worked hard, shown success, shown passion, and we hope that that'll eventually translate into a passionate approach to their career.
Love it. And I have a question for you, Dr. Elgard. Another one that I always get is students will ask me all the time what we think makes for the best residents. So what sort of residents thrive in our program? What sort of residents are really happy in Miami? You know, you've been doing this for a long time. You've trained
very long time,
hundreds of residents, right? So what have you noticed? You know, what characteristics, qualities really result in a very happy, thriving resident here in Miami?
Well, it's usually a combination of a couple of things. One is I think that it helps to be a self-starter here. You know, even though I think we have a good academic program and we have a lot of interests and opportunities for residents, I also think that some of the most successful and best residents have been ones who took advantage of opportunities that they saw and broadened our focus, sometimes expanding it to things such as international medicine, like a certain Brian Morrison did way back. And so, I think people who look at it with the idea of how they can expand what we have and probably bring energy to interest in dermatology. And I think it could be over a wide variety of things. We've had people who've been successful as research scientists, as clinicians, as self-starters, as entrepreneurs. Really, we've seen the gamut. So it's not one specific thing, but it's energy and it's enthusiasm for expanding what we do.
Love it. So looking through the questions I'm getting, it reminded me that I completely forgot to mention something about the signals, right? So because we have 3 different tracks and they're all technically different programs that you would rank differently, we don't want our applicants spending 3 signals to apply to all 3 tracks. So candidates really only have to apply to the main traditional track. And then we'd like you to email our coordinator, program coordinator, Vanessa, and we can put maybe her email in the chat box for everyone. And so reach out to her and let her know which of the tracks it is that you're interested in. So that way we can really make sure that we consider you for that track if you think it's something that you would like to do, such as the disparities in medicine and the research track. All right, thank you so much. All right, so I'm going to start with the first question here in the list. So what pipeline initiatives does Frost provide for interested medical students? For example, away rotation, summer research programs, etc. Dr. Kurzer, you want to take that one?
Sure. So we do have away rotations. We actually spend a lot of time in our selection process for those people who do away rotations. It's selective, and those people who come for away rotations, at least this year, we're interviewing them while they're here. That way they don't have to come twice, but we want everybody to be on the equal footing. That is, we want everybody to have an in-person interview. We don't want to interview some people virtually and some people in person. That would create a disparity in how we evaluated them. We also have as was pointed out, we have a very large faculty, and we have lots of opportunities to do research with our faculty. And many of our faculty work with both University of Miami medical students and outside medical students during their course of their 4 years in medical school. So reach out if you're underclassmen, and there may be opportunities for you to get involved.
Right. So our next question is, and I'm not sure I completely understand, how does Dermatology medical education track? So I think that this might refer to one of our old tracks on like the clinical educator track on the website. So you may want to review, we recently changed this, so we don't have the clinical educator track anymore, but you specifically, it seems like the point was that this person wanted to work in the setting of scholarship and teaching residents, right? So that's something that we strongly encourage. In fact, our junior residents learn a ton from our senior residents. They're probably some of the most important people in their lives right now. All these are new first year residents. It's a transition coming in. And so as a resident, you have tremendous opportunities to teach students and your colleagues, as well as the faculty, really. And then, of course, we love for when our graduates stay on in academia and contribute to future leaders and residents going forward. So let's see, Matthew, is there flexibility on the research track? 2+2 versus 1+3. So no, unfortunately, we only offer a 1+3 track. We don't have a 2+2 track. So it is only the 1+3. Then good clinical experience or research experience in derm is considered more important. So I guess this person wants to know what we value most: clinical experience or research experience when we're reviewing these applications. I think we consider both very important. I don't think either of them, I don't think, anyone who is really lagging in the clinical side, but excelling in the research would be a good fit, because we have a very robust clinical service. And so there are a lot of clinical duties. And so I think that we really need a good balance of the two. I don't know, gentlemen, what do you think? Do you agree with me on that?
Well, I think it's variable in that, we can take someone who has a specific interest and help, expand them more strongly in one area, whether it's research or whether it's in clinical things. But I think that it's hard to say precisely what we would look for, because, I think residency is about fit. Everybody listening to this webinar is capable and good. And we'd love to take all of you, but salary lines are limited, and we really have to focus on people who fit well with our situation. So I think that it's difficult to to say that we value one over the other, but I also think that we really value both. And we're lucky to have benefited from people who are excellent clinicians, and also people who bring some amazing research ideas every day.
And I agree 100%. Let me just add one thing. When people come here to train, our goal is to make them great. And they're going to choose what area they want to be great in, but we want to make sure we facilitate their greatness. They don't have to be just like me or just like George Elgard or just like Brian Morrison. We want them to be their own individual and excel in the area of their interest. And that could be in clinical practice. It could be in industry. It could be in academia, but the clinical side of academia could be in academia, but the research side of academia. And we want to give all the resources possible. So during the 3 years, they'll be in a position to have an exceptional, both happy and successful life ahead of them, a happy life and a successful career.
Excellent. Well said. The next question is about taking a research year before applying. So that isn't mandatory for our program. We've taken many students who did not take a research year, so that isn't required to be considered for our program. Next question is information about participating in street medicine. So absolutely, that's something that our residents are always invited to do. So one of our faculty, Dr. Kira, and myself, as well as Dr. Hadar Levtov, have been really strongly involved in this. And so residents are always invited to everything. We never turn away our residents or medical students. If they want to come with us to see patients, they're 100% invited all the time. And many of them do. Many of them are really have a heart for service, and that's what they're, they get excited about. So for incoming residents that are interested in the academic training program, so again, we don't have, so I think maybe they're talking about the Dr. Pause's dermatology academic training program. So all of our residents participate in this automatically. So all of our residents have a research project, all of them engage with our research faculty, and all of them participate in this program. So you don't need to apply for it specifically. It will automatically become integrated in your training. The next question is about applying for
Let me just add one thing. So we asked the residents to participate in research, not because we expect all the residents to go into academia or all the residents to go into research. We think that getting involved with research is important to broaden your mind and how you think about problems and clinical problems if you're in practice. And we think it makes you a better dermatologist if you've experienced a little research during your training and early in your career. For some of you, however, you may have a strong interest in staying academics. And we have this program, the Dermatology Academic Training Program, which provides additional mentorship for those people who might have an inkling that they want to head to academics, and this helps to facilitate their entry into that type of career.
Right. Thank you for clarifying. So the next question was about applying to multiple tracks. And so yes, candidates are welcome to apply to multiple tracks. You can signal the traditional program and then email our coordinator telling them what track specifically you're interested in. Again, do we need a full year of research to apply to UM? No, that is not the case. Let's see. If they're interested in the disparities in medicine and community health track, you don't have to specifically choose it on ERAS. You can just apply to our regular track and send us an email letting us know that you're specifically interested in that track. For people coming from programs with pass-fail grades, with pass-fail step scores, do you filter by people's step 2 scores? No, we do not. We will be reviewing all the applications who send us a signal, either a silver or gold, and we'll be performing a holistic review of those applications. So we don't use any measure to filter applications. How does University of Miami program view applicants who have participated in activities which didn't necessarily result in peer-reviewed journal articles, like working in biotech entrepreneurship? What do you think, Dr. Kersner?
Everything you do counts. And, you know, if you got a PhD, that counts. If you did great in high school and went to a great college, that counts. If you did great in college and went to a great medical school, that counts. So we count everything that you've done in the past towards our evaluation of you. So if you were a highly successful person in the biotech industry, well, that counts.
I agreed completely. So our next question is, are there opportunities for interdisciplinary research collaborations, like with the departments of psychiatry, pathology, immunology, et cetera? Absolutely. And I think these programs are very happy to work with us and our residents. Certainly past residents have done that. Many of our faculty have interdisciplinary clinics, like psychodermatology, for example. So I think that this is highly encouraged by our institution and our department. The program is open to foreign medical graduates, and we have trained many in the past. Clerkship rotations for medical students will be online or face-to-face. So for visiting students, they are face-to-face, and they must be 4 weeks long. And they're limited right now to 2 externs per 4-week block. So we're taking a total of 8 people. So that's it. There'll be a total of 8 external candidates that are invited per year to rotate with us, and they are automatically interviewed during the time of their rotation. So I think I have another question here. So yes, the Disparities of Medicine track, as I mentioned before, is a separate track. So they will be those people who send us a signal and notify that they're interested in that track will be ranked separately from the traditional track. So this is a totally separate track. There's going to be a different NRMP number. And so these people will match into the health disparities track. And again, their clinical education is equivocal to the traditional track. However, all of their research and quality improvement projects will involve in working on health disparities in medicine. And this track comes with a select group of mentors to really help, shepherd them along the way and really maximize success in this area. So how many research track applicants does the program plan to recruit this cycle? We typically take 1 per year. Occasionally we take more if they're, tremendously good fits, but for the most part, it's 1 a year. Are there opportunities related to global health initiatives available for residents? Absolutely. So this year alone, in December, one of our second-year residents will be joining me for a week in Jamaica to help establish a partnership with the Department of Dermatology and University of West Indies, Mona. And then another resident will be joining me and Dr. Maderal in February to the University of Sao Paulo, as well as Belo Horizonte in Brazil, where we're going to work on immune bullous disease and Hansen's and foster more collaboration there. So our residents are very much involved in that. And this is.
I just want to mention one thing, that if somebody was not in our research track, but came and fell in love with research and said, listen, can I take another year to do research? We would make that happen. Mm-hmm. And that's just part of trying to prepare them for what their future career may look like. So the good thing about being a big program is that we do have some inherent flexibility in that we can personalize people's training, even to the degree of giving them a research year, even if it wasn't necessarily planned on it from the very beginning. Right,
absolutely. I see another question about foreign medical graduates. So yes, we do consider them. Are U.S. citizens studying medicine internationally allowed to apply for rotations and the match? So currently we're not accepting additional rotators. We do take observers. So that's a possibility, and you could reach out to our department. And yes, again, we do consider U.S. citizens and foreign medical graduates when we review applications. Do we have recommendations for reapplicants in addition to sending a signal to convey interest? So really, it's only the signal at this stage. The APD has generally discouraged additional emails, messaging, letters, having mentors reach out to you. So we don't really encourage that. Send us, if you're interested in our program, send us a gold signal. That will let us know. All right. Happy to hear that we have some people from Brazil saying hi. And how many positions are allotted for the main track and the diversity track? So there's one position for the diversity track, and the traditional track I have to review again, but it's either going to be 5 or 6. This we have to discuss, but it is either 5 or 6 traditional, 1 diversity, one research track. And I think we actually managed to get through all the questions. I'm impressed. So if you have more questions, please don't be shy. You can feel free to send Vanessa your questions, and if she doesn't know the answer, she'll forward them along to one of us, and we can get back to you on that. Thank you so much for joining us. We really appreciate your interest, and we look forward to meeting you in Miami. Any final comments from either of you?
Just to say that I think now good luck is right, and we're going to rotate now into a session for those interested in the research year. So we have some of our faculty who are doing that, and we're going to talk about the research track and the specifics of that. So thank you all for joining. If you're not interested in that track, it was great to have you join us, and I want to thank Dr. Morrison and Elgar for their great job tonight.
Yeah, and you can stick around, learn about the track anyway. Maybe you become interested in the track, right? So, all right. Bye, everyone.